Arthritis. Your joints are where two bones meet, like your knees, fingers, and hips. They're wrapped in smooth, slippery cushioning called cartilage. Imagine your joints are like door hinges, smooth and oiled, letting you move easily. But with arthritis, those hinges get rusty and creaky. The cushion called cartilage wears away, leaving bone grinding on bone. Swelling and stiffness turn simple tasks like opening jars into battles. There's no magic fix, but exercise and medicine work like cooking oil on that hinge. They won't fix the rust, but they'll help it move smoother and hurt less. Asthma. Picture trying to breathe through a coffee stirrer. That's asthma attacking your airways. When triggered by pollen, stress, or cold air, the tubes swell and squeeze shut like a clenched fist. Your lungs scream for air, making a loud whistling noise. But rescue inhalers, they're like a superhero prying those fists open, flooding your lungs with sweet, sweet oxygen. Diabetes. Your pancreas is a little organ behind your stomach that works like a factory. Its job is to make insulin, which is a special hormone that unlocks your cells to let sugar in for energy. Normally, insulin keeps your blood sugar from getting too high, but with diabetes, this system breaks down. In type 1 diabetes, the pancreas factory shuts down. It stops making insulin hormones entirely. In type 2 diabetes, the locks on your cells get rusty. Even with insulin hormones, sugar can't get in. Sugar piles up in your blood like cars in a traffic jam, damaging nerves and organs over time. But testing your blood sugar? That's like checking the traffic report to avoid a crash. High blood pressure. Blood vessels are like garden hoses. Normal pressure keeps water flowing, but high blood pressure is a kinked hose, forcing water, in this case blood, to push too hard. Over time, the pressure weakens the hose walls. Two terrible things can happen. 1. A stroke. The hose cracks, flooding the brain with blood where it shouldn't be. And 2. A heart attack. Gunk builds up where the hose is damaged, blocking blood to the heart. The scary part? You won't feel the hose weakening until it's too late. Too much salt in your diet is often the sneaky kink maker. Alzheimer's. Think of your brain's memories like photos in an album. Alzheimer's doesn't erase them all at once. It starts by stealing the newest pictures first. That's why someone might forget where they put their keys yesterday, but still remember their daughter's name from 30 years ago. Soon, even the oldest, most precious memories fade, like photos left out in the rain. Families become strangers, and cooking turns dangerous. Research races to find a tape to repair the pages. Epilepsy. Imagine your brain as a giant city with billions of tiny messengers, neurons, sending notes to each other along telephone wires. Normally, they take turns talking like polite kids in class. But during an epileptic seizure, the wires go crazy. Suddenly, all the messengers shout at once, like kids screaming when the teacher leaves. This electrical riot spreads through the city, and what you see happens is 1. Muscle jerking. The messengers accidentally call the muscle cells non-stop. 2. Staring spells. The thinking part of the city freezes like a crashed computer. And 3. Loss of consciousness. The consciousness center gets too many calls and shuts down. Epilepsy sometimes happens from a brain injury, genetics, or fevers in kids. It's not dangerous, but scary looking. Like when a computer reboots. The system isn't broken, just overwhelmed. Most seizures stop by themselves in 1 to 2 minutes. Migraine. Imagine your brain's alarm system goes haywire, turning normal lights, sounds, or even smells into torture. A migraine isn't just a bad headache. It's your nerves overreacting, causing a strong pain, usually on one side, nausea, and sometimes weird visual glitches like flashing lights or blind spots. Migraines can be caused by stress, lack of sleep, certain foods like aged cheese or wine, bright lights, or even weather changes. For some, it's genetic. Thanks, Mom and Dad. How it affects daily life. You can't look at screens or be in loud places. Simple tasks like cooking or driving feel impossible. Some people lose hours or even days hiding in a dark room. How to treat it? There are some quick fixes like painkillers like ibuprofen, caffeine in small doses, or migraine-specific meds like triptans. But the best thing is prevention. Track triggers, stay hydrated, and get regular sleep. Parkinson's. Parkinson's disease is like your brain's movement manager slowly quitting its job. Dopamine, the chemical that keeps motion smooth, starts drying up, leaving your body to glitch like a rusty robot running low on oil. Your hands shake, turning a simple cup of coffee into a spill hazard. Your muscles stiffen until walking feels like dragging through wet sand, and even your face can freeze into a stiff mask, making smiles harder to make than they should be. Parkinson's disease usually shows up after 60, though sometimes earlier. And while we know dying brain cells and genetics play a role, there's still mystery around why it happens. Maybe toxins, maybe bad luck. But one thing's certain, it turns everyday movements into frustrating, exhausting battles. Depression. Depression isn't just feeling sad. It's like your brain's happiness system has completely shut down. The lights are on, but nobody's home. The main hormones like serotonin, your feel-good signal, dopamine, your motivation fuel, and norepinephrine, your energy boost, stop working properly. The little things like answering a text, making breakfast, even remembering what joy feels like become exhausting mountains to climb, while a cruel inner voice whispers that everything is pointless. Your body moves through molasses. Sleep either abandons you completely or overstays its welcome, and socializing feels like trying to swim through wet cement. Every word takes enormous effort. It's not a mood, it's a system failure, sometimes triggered by stress or trauma, sometimes by unbalanced brain chemistry, but always more real and heavy than outsiders could ever understand. Lyme disease. Lyme disease is an infection you can get from a tick bite. Ticks are tiny bugs that attach to your skin, and some carry harmful bacteria called Borrelia. When an infected tick bites you, it can pass these bacteria into your bloodstream. If not caught early, the bacteria spread through your body, causing problems in your joints, nerves, and even your brain. At an early stage, you might see a red, bullseye-shaped rash around the bite and feel like you have the flu, tired, achy, and feverish. At later stage, and if untreated, the infection can cause severe tiredness like your battery is always dead, joint pain that moves around, trouble concentrating, and even nerve pain or heart issues in rare cases. Lyme disease is often tricky because ticks can be as small as a poppy seed, so people often miss the bite. Symptoms can feel like other illnesses, so doctors sometimes don't test for it right away. Pneumonia. Pneumonia is a lung infection that makes it hard to breathe. Normally, your lungs fill with air like balloons, but with pneumonia, they fill with fluid or pus instead. Germs like bacteria, viruses, or fungi get into your lungs, usually after you breathe them in or catch them from someone else. Your lungs get inflamed and fill with gunk, so oxygen can't move easily into your blood. If you have pneumonia, you'll feel awful. You'll cough, sometimes with yellow or green mucus. You'll have fever, chills, and breathlessness. Even walking feels like climbing stairs. In bad cases, your skin or lips might turn bluish from lack of oxygen. Pneumonia is a very serious illness because without treatment, your body can't get enough oxygen and organs start struggling. But with rest and meds, like antibiotics for bacterial pneumonia, most people recover. Osteoporosis. Osteoporosis is a condition where your bones become weak and fragile. Over time, they lose so much density that even a minor fall or cough can cause a fracture. Osteoporosis happens when your bones lose strength over time because your body starts breaking them down faster than it can rebuild them, especially after age 50. Women lose bone quickly after menopause when estrogen drops, while men are affected when testosterone gets low. Not getting enough calcium or vitamin D from food makes bones weaker year after year, and lifestyle choices like smoking, drinking too much alcohol, or not exercising regularly leave bones without the support they need to stay strong. The scary part? You won't feel osteoporosis weakening your bones until one suddenly breaks, usually in your wrist, hip, or spine. The good news? You can fight back. Regular weight-bearing exercise, getting enough calcium and vitamin D, and checking bone density after 50 can all help keep your skeleton strong. Anemia. Anemia happens when your blood doesn't have enough healthy red blood cells to carry oxygen properly. It's like your bloodstream is a train system with too few cars. Your organs and muscles get starved for oxygen, leaving you constantly tired, weak, and short of breath. The most common type happens when you don't have enough iron, but it can also be caused by blood loss, poor nutrition, or other health problems. Without enough oxygen delivery, even simple tasks feel exhausting, like your body's battery is permanently stuck at 20%. Stroke. A stroke is a brain attack, a terrifying medical emergency where every second means life or death for your precious brain cells. It strikes suddenly when blood flow to part of your brain gets cut off by a clot, or when a blood vessel bursts, causing irreversible damage within minutes. One moment you're fine, the next your speech slurs, your face droops, or half your body goes numb, as if your brain's control centers are being violently disconnected. The cruelty of stroke lies in its randomness. It can steal your ability to speak, walk, or remember loved ones in an instant. Yet there's hope. Immediate medical treatment can literally mean the difference between full recovery and permanent disability. This is why recognizing face drooping, arm weakness, speech difficulty saves lives, because when brain cells die, they don't come back. Heart attack. A heart attack is your heart screaming for help. A life or death crisis where blood flow to part of your heart muscle gets suddenly blocked. Imagine a kink in a garden hose starving a precious rose of water. That's what a clot or plaque buildup does to your heart. One moment you feel fine. The next comes crushing chest pain like an elephant sitting on you, cold sweats, and a terrifying sense of doom. Every minute without treatment means more heart muscle dies forever. But here's the hope. Rushing to the hospital can stop the damage, saving your heart's strength and your life. This is why knowing the signs like chest discomfort, arm pain, shortness of breath is so powerful. Because heart attacks don't just happen to others, they happen to people like you. And acting fast is the difference between a close call and a catastrophe. More videos like this one are coming up soon. Subscribe and stay tuned.